What's up, YouTube? It's Nathan, and it's Friday. The I think it's like the the 4th of May, and I am 4 weeks post-op, and this is my update. So I wanted to talk about how I feel. I have been pretty upbeat, but I have been struggling to adapt to this fluid in my chest that has accumulated and just won't go away for the life of me. But it very well is because John Nathan did not rest, y'all. I had another surgery, of course, and so it is all on me that I was up and moving. My food is fine. I just bought me some dinner because I'm hungry. I want to eat in a minute, but I wanted to talk about it because I just want to talk about it because it's how I feel. So you guys know that my doctor did not want to give me drains, and it was various of reasons. I completely understood, and I still understand. And he said to continue to bind, and he wanted me to get my silicone strips that I'm supposed to wear on my incisions once the scabs fall off. All of the scabs are now off. I have not ordered my silicone strips because I'm a little hard-headed, but I have been treating my areolas and my incisions very well. The problem is I feel like I now have man boobs because my chest has so much fluid in there at the bottom. And y'all see that? And I got a good amount of pec. All of that there is my muscle. But under there was a little bit flatter. And it's now fluid. And more fluid. And it looks like it's stretching my skin. And I am having a hissy fit, y'all. So I want to know if anybody know any home remedies to reduce the fluid other than wearing a binder 24 hours a day and just letting it go away on its own. And of course, I'm trying to keep good fluids in my body so I can pee off as much of any water on my body as I possibly can get off. But I would really like to know. I saw on YouTube a couple of guys who had mastectomy surgery, and they actually aspirated the fluid themselves with a 22 gauge needle and around the same needle that I use to do my injections. And they just aspirated and unscrewed the syringe and poured out the fluid and kept doing it that way right up under here. Like they just went a little bit with the bevel, make sure the bevel passed the skin, but they didn't stick the needle all the way in. I wouldn't do that anyway. But they just got the bevel in, which is just the whole opening of the needle, and they drained it themselves. So I'm really, really, really tempted to drain it myself. But I do not recommend it, and I do not know if that's what I'm going to do because my doctor is in Tijuana. I do see my primary care physician. I don't know how trained she is, but she's been a primary care physician for a while. She should know how to drain it, but I don't know if she'll feel comfortable. But I'll talk to doctor folks in the morning and see how she feels about draining it because I am over the fluid. And I just can't function because it looks like my chest is now starting to go in reverse. Y'all might not think so. Y'all might think like, oh my God, John Nathan, you is just in your head right now. But the fluid has gotten tight, so I'm having issues with my skin stretching over. Let's see if y'all can see. But over here, y'all can't see it. Hold on, over there. It's pulling my incisions. Y'all, I'm feeling good as shit. So the last thing I want is my incisions stretching. I don't want them stretching. Because as y'all can see, they look awesome. The color in my areola over here, which was missing all the color. Hold on. Let me see. Y'all see that? That color is popping up already all around the edge. Remember, y'all, this was skin that was irritated from the sutures. So that really wasn't part of my areola. All of that, that's going to have to heal. But I'm really taking care of my areolas. And that areola, which I call it the cow areola because it look like cow spots, it's all filling in perfect. And my incisions, is really, 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 really non-existent. Y'all see him, but y'all don't. So, what I'm doing for that is, like I said, I was putting on the cocoa butter with the vitamin E. It was 400 milligrams, 5 tabs that I poked holes in and put the pure vitamin E into the cocoa butter, 100% cocoa butter, and I rub 3 times a day on my chest. On my areolas were drying out just a little bit from the cocoa butter, so I just decided to use 100% vitamin E. Just rub the vitamin E on each one, and that's doing wonders. So whenever it dries out, I'm just cleaning it with some fragrance-free feminine wash, because it doesn't have a whole lot of ingredients in it, and it's doesn't smell like a whole lot. So I've been cleaning them with that and just pat and dry still for some, just in my mental state, in my brain, I just think I should still just pat and not rub. And then I'll just rub, I do rub the vitamin E on it just a little bit on both of them, and it's just doing a lot. And for my stomach, which was jet black from the color from them cutting me open, it's a little bloody there just a little bit because it kind of leaked out some. All of that darkness gone, because y'all know what I did. I used the arnica, the topical, and I've since ceased the topical arnica because the color is back to normal on my stomach after I think like 4 days of using it, maybe less. So I'm not using it anymore because it was toxic when I was taking it under the tongue, and even though it's not toxic using it on the skin, I just want to be on the safe side, so I'm not using it. But like I said, my chest looks great, but I am having a hard time knowing that I got the seroma, which is the accumulation of fluid in my chest. I'm having a hard time with it because it's just a little uncomfortable, and my doctor said it can take several weeks to just absorb, but it is going to absorb on its own. It's up to me if I want to aspirate it. He said the risk of developing scar tissue again was high. So it's up to me. Do I want to risk the scar tissue after all I've been through? No. Do I want to keep living with this water? No. So I'm going to talk to my primary care, see what she says. And if she can't do it anyway, then I'll just let it be. And I'll just apply some hot towels to it, and I'll just wear my sports bra. It's a really tight sports bra, but it's more comfortable than wearing a binder, and it just looks nice, and you can't tell I really have it on. It doesn't irritate my incisions, and I got a couple of those that I kept, so I'm going to just stick with that if need be. But as far as my stomach is concerned, my stomach has healed nicely. I just have this knot around my navel, around up in here, that it's hard. But the colors has come back. The swelling is going down really good, and I'm not in as much pain as I was. Today is actually my tea day. Oh, no, it's not. Only if I was going to do weekly. But I'm not going to do weekly. I'm going to stick with bi-weekly per me and my doctor's original decision to do bi-weekly. So yeah, but overall I think my chest looks good and I feel great, and I'm just a little aggravated about the water. But hey, you can have top surgery, have drains, and develop water after, and that's what my doctor said. So yeah, I don't know, but I just wanted to talk about it. Yes, honey. I just wanted to talk about it for a few minutes. Then I gotta go eat because my food is sitting, and me and my wife is going to the movies, so I gotta eat up and get ready. But as y'all can see, I'm growing my beard back, y'all. I'm bald. I'm gonna stay bald for a while, probably some months, maybe longer. I don't know. But I decided to grow all this back, so my hair is going fast as shit. Look at my face. So I'm gonna let my beard grow and see how it goes. I want to start doing some cardio, but I'm gonna wait till my post-op appointment with Dr. Well, it's not my original surgeon, but with his colleague, tomorrow morning to see what he thinks about letting me do some leg cardio, which will only be riding my little elliptical bike, just sitting down so I don't strain too much. I'll just be using my legs. But I'm going to talk to him and see, because I need to work out. I can't do this. But, yeah, as far as my chest is concerned, I'm going to take it easy with that. I'm not going to do any heavy lifting or even trying to lift for at least, what I got, a month, 1 month post-op so far, probably about 2 more months. But since I recover so fast, y'all, and I'm healing so quick, I'll call Dr. Kaloka and see what he thinks, like once I'm 3 months in or at least 2 months in, and let him know how much I've healed, send him some photos, or even go see him, see if he can let me start small lifting, and yeah, take it from there. But I know I'm supposed to wait at least 6 months, I believe. I don't know, but y'all know I'm hard-headed, so we gonna find out. But yeah, so my voice was a lot deeper earlier today, but I just took my blood pressure. It's all dry. I'm thirsty. But overall, I am feeling fine, and I'm doing well. Wife is doing well. We're scheduled with OB. We got her ACG levels. ACG levels are nice and actually high for the amount of weeks, but we'll see. So we'll see her early June. I was happy to know that my favorite OB is going to be our OB, because they were giving us a hard time with her schedule and they were trying to send us to a different OB. But she pulled some strings and got us in, so we'll see her. Then we'll post on our channel. We haven't, because it's been hectic around here. And we're going to be getting my niece, y'all, my only niece. Out of all the, well, not really my only, because my brother has a daughter, but that's a whole other story. But my sister has a daughter, and she has 5 sons. And I'm going to be getting my 13-year-old niece, who is 6 feet tall, to spend the summer with us. It's going to be a lot of girls in this house, but I can't wait to see her and spend some time with her, because she really needs us right now. So I'm excited for that. But I just wanted to talk, y'all. So I love you guys. Have a great weekend. It's Thursday. I'll see you guys soon. But yeah, my main topic was just the water on the chest after the fact. If anybody got some tips, please pass John Nathan the tips, because Mr. Nathan would really like to know some extra tips to help get the water off the chest when it forms. And when you guys think you should start working out, just or when did you guys start working out with the chest once you had surgery? I just want to know what you guys think, or what you guys experienced. And if anybody have some odd experiences they had after surgery and during recovery, I would like to hear that too. So share it with me, and I'll appreciate it greatly. But have a great weekend. Like I said, you guys, I love you guys. Thanks for following and subscribing. And again, don't forget to check out our other channel. And take care. Bye.